My whole point of this is to help educate on Parkinson's.
Okay, I was diagnosed in 2006.
Did you first notice it when you started practicing?
More, well, when I was practicing and trying to play the piano. But see, I just
So
shook
that's
it
when you
off. Yeah, I just thought when I was playing the piano that I was just nervous.
So those were the first symptoms.
Yes. And the first symptom was like as I would reach for an instrument, yeah, just a little tremor. It would go away. And then nothing happened. That was oh gosh. That was probably in the early fall of 2005. And then as the months kept going, the next thing that happened was my penmanship. And then the next thing that happened, well, the tremors, my arm just stayed sore all the time, and my shoulder, and I couldn't write. And then in January, when I finally decided that I guess I should go see a doctor, and he referred me to someone else because he didn't know what was wrong with me. And that's when I saw the first neurologist, and he diagnosed me with essential tremors, and we started with blood pressure medication, and things just started getting worse. So I went to a chiropractor. I finally asked the neurologist for an MRI because I'd finally decided I had a brain tumor and that it was pressing against a nerve and all of this. So he agreed to do the MRI, and it came back, of course, fine. And that's when he finally asked me if I would feel more comfortable if he got me into a movement disorder clinic, which was at Vanderbilt University. It was probably a good 9 months before I was diagnosed.
And has the medication worked?
Yes, it has, and it still does. But as time progressed, I started losing the dexterity in my right hand, and it was dangerous to try to flip an instrument anymore, with the worry of harming my patient. It's increased my medication. So by 2011 I was taking 13 pills a day, and I'm now taking 4.
And what changed that?
What changed it? Well, number one, I had to give up practicing because the more that I do use my right arm, the worse the tremors are. But I also believe I'm exercising, and I believe that it has to do with this mouthpiece that I now wear. They have found that a lot of TMJ problem mimics Parkinson's signs. And this appliance that I wear is, it says it's not pushing against the nerve, something. And I do watch my diet. I do exercise because all of these things play a big role, because I do take the carbidopa-levodopa. And with my research, it usually says 5 to 6 years after you've been on carbidopa-levodopa, that's when you start developing a side effect from the medication, which is dyskinesia. Since a lot of it is side effects from the medication.
Well, that's great.
And I mean,
great.
What I would like for the hygienist to know, that there are 10 warning signs.
Okay.
Of course, the tremors and the small penmanship, the walking, the dizziness. See, I had a lot of inner ear. I laid blame to vertigo a lot. But we think that's all connected, which is also connected to the TMJ. I don't have the soft voice speaking. My husband prays for that. No.
Is it genetic?
It can be. It's not all. A lot of it is environmental. And see, I grew up in the country on a farm, and all the pesticides and everything that we had, and I had well water as a child growing up. And we were in the heartland of tobacco. The farm, it was tobacco, hay, corn, everything, and everything was pesticides. And my mother's sister passed away with Parkinson's.
speak on you now speak on Parkinson's.
Yes, I do. At Vanderbilt University at their Parkinson's symposium, I educate the patients on understanding that the medication that we are taking develops severe dry mouth. And I use a lot of fluoride, I use a lot of xylitol, and I use perio trays. You know, the Sonicares, the water picks, I use it all. But
And they can find you at the Perio Protect booth.
that's correct, yes. Yes, I'll
So
be.
if they have any other questions, they can come find you and talk to you.
That would be great. I would love that.